Welcome to Onslow Memorial Hospital's CEO Corner for August 2021. I'm Penney Burlingame Deal, the President and CEO at Onslow Memorial Hospital, and I'm grateful to be here. I have some great news to share with you. It's very exciting. On June 30th, we had the pleasure of entertaining the Joint Commission. They were here to recertify our Advanced Primary Stroke Center. This, by the way, is the fifth survey that's been conducted since 2012, our initial survey. As you can tell, it's been a long journey. A decade is certainly a long journey, and it's been one that's been very successful. This began in 2011, actually, when Dr. Josephine Malfitano dedicated all of her doctoral work towards stroke care in Onslow County. She brought with her the support of leadership at the time, which was Dr. Ed Piper, and a board member who had actually suffered a stroke. And he brought all the passion and concern about what he could have done before he had the stroke to the community and to the program itself. As a result of that doctoral work, we actually received grant funding for a stroke nurse coordinator position that we then funded for the following decades through the hospital, because we knew how important it was to the county and to the community. As the buckle of the stroke belt here, we know that there are social determinants of health and health disparities that we need to address. Certainly, when you look across the population, you see whether it's tobacco use or diabetes or high blood pressure. These are things that contribute to perhaps being a high-risk individual for stroke. And so it certainly was a passion on the leadership's part, as well as the stroke nurse coordinator, to address this out in our community so that we have a healthier population. The surveyor had so many complimentary things to say. She was here for one day, and some of her key takeaways focused on things like our community partnerships, our outreach and education. It focused on the stellar job that we did in remaining consistent during a pandemic environment. The community partnerships were things like when we went to summer events and did what's your next 10? So my next 10 is to lose 10 pounds or to take 10 points off my blood glucose. Also, the work that we do with EMS for timely identification of stroke symptoms and then getting them to the hospital as quickly as we can. So she was very complimentary of that as well. The other thing that she did was, as surveyors will do, they'll introduce best practices and recommendations. And this actually were things we were already doing. She gave us 5 key takeaways. So I'm going to give you a brief public service announcement on behalf of Penelope McCabe, who is our stroke nurse coordinator right now. She's amazing, by the way. Incredible enthusiasm and expertise for the role. And owing to that is that she asked me to do a PSA. So, so the first one is early identification of symptoms, right? If you are potentially a high-risk individual. And we do that through our BFAST triage assessment tool. And BFAST is an acronym for things that you look for: balance, if there's any change in balance, eyes, vision, F is face, any facial drooping, A is arms, any swaying of the arms, any drift of the arms when you ask someone to lift them. S is speech. Do they have slurred speech? And then T is timing, which every second, every minute counts when someone is potentially having a stroke. So call 911. The next point is about calling 911. So do call 911 instead of trying to put somebody in a car and taking them by private vehicle. The fastest way that we can get someone to the hospital for assessment is the best way to go. So call 911. Next is follow up with your primary care physician. And your primary care physician is going to identify if you are indeed a high-risk candidate for stroke. And if you are, he's going to follow that up with a treatment regimen. So the next point involves following your treatment regimen. If he prescribes medication for you, take your medication. If he says reduce your salt intake, reduce your salt intake. So definitely follow up with your primary care physician and then follow the treatment regimen that he outlines for you. And then finally, it's recognition that Onslow County has some of the highest incidences of the things we already talked about: high blood pressure, diabetes, obesity, and heart disease. All of those things contribute to you potentially being a stroke victim. And whatever you can do to reduce that. So understand where we fit in, again, the buckle of the stroke belt. So I do want to thank everyone for their leadership, their enthusiasm. That would be staff, that would be medical staff, that would be leaders in the organization and board members for everything they've done, whether it's working behind the scenes and taking care of our stroke patients, participating in the survey when the surveyors were here, contributing to a very, very successful program. Thank you, Penelope, everyone else involved, and I appreciate your efforts to all of you, and I couldn't be prouder. Thank you.